Thank you, Mr. Chairman, for hosting this hearing, and it's good to know that we have an administration that is prioritizing making America healthy again and fighting for children who want safe, healthy food and for Americans. And I think that that's refreshing, so we really appreciate this. Dr. Studi, I've got a few questions for you. First of all, what is health equity?
It's the consideration that all individuals have equal access to healthy foods or different aspects of the health system.
I think all individuals should ideally have access to healthy food. Do you think that that should be the central lens through which we look at health?
Supporters of this approach argue that health equity should be the guiding principle in shaping dietary guidelines. They believe that without prioritizing equity, the guidelines risk catering only to those who already have access to good health care and healthy food, while millions of Americans remain marginalized. For example, telling people to eat more fresh fruits and vegetables may be sound advice scientifically, but it becomes meaningless for families who cannot afford them or live in areas where supermarkets are miles away. Equity-focused policies push for solutions that address such systemic barriers, whether through subsidies for healthy food, community nutrition programs, or investments in local food systems that make fresh produce more widely available.
It is certainly an area of research and discussion.
But the central lens, do you think that makes sense?
You're relating to the work of the 2025 Dietary Guidelines Advisory Committee that the previous administration did ask them to conduct their review of evidence with a health equity lens.
Well, are you familiar with this article entitled, it was from the American Journal of Clinical Nutrition. It's called Addressing Misinformation About the Dietary Guidelines for Americans?
Yes.
Okay, and were you an author of this article?
Yes.
Okay, I thought so. Your name's on the top. It's the second author. One of the statements in this says, quote, in addition, HHS and USDA have prioritized health equity as the central lens through which all scientific questions will be considered in the 2025 DGAC. Do you think that makes sense?
That was the request from the administration, and that was carried in through the charge to the committee.
But do you think that this is a proper way to go about promoting nutrition?
It is one of the discussion points it's one of the topics that is being discussed.
Well, I'm asking if you think that this is a proper way of going about promoting nutrition in the United States. Your name is on this article.
My perspective on that is I think it's good to look at evidence in all ways, and that can include through that perspective.
Do you think it should be the central lens?
I did not. That was the request from our administration. But
you don't think that that's
is the charge?
You don't think that that's proper?
I didn't write the specific charge to the committee.
Well, your name is on the article.
Yes, and the article is talking about what the request was to the 2025 committee.
And I'm asking you if you think that is a proper lens to view nutrition through.
Critics argue that this is a textbook case of conflict of interest because the guidelines are supposed to be built on unbiased scientific research, not on the financial interests of corporations or the personal ideologies of committee members. If someone is financially connected to a company that profits from dietary recommendations favoring plant-based diets, it becomes difficult for the public to believe that the science is being evaluated fairly. The concern is not just about one person or one company, but about the overall integrity of the process. When people see that advisors may have ties to industries that benefit from their guidance, they begin to question whether the guidelines are truly designed for public health or for private gain. On the other hand, defenders of the current system argue that experts inevitably have professional and financial ties to various organizations because that is how research gets funded. They claim that expertise in nutrition often comes from conducting studies funded by industries that produce food, whether plant-based or animal-based. In this sense, conflicts of interest are nearly unavoidable. What matters, they argue, is whether these affiliations are properly disclosed and whether safeguards are in place to ensure decisions are still based on the weight of evidence.
True.
I think it is a lens that you can view nutrition
Right.
through. I don't
But
think
is it
it's
a
the
proper
only one.
lens? Well, this says central lens.
Again, as a career employee in the Department of Agriculture, I implement the requests of our administration, and that was at the time with the Biden administration, the request.
Right, but we have a new administration with different priorities that don't include DEI and health equity. Do you think that this is a proper way to view nutrition?
I think it, as I've mentioned, that it is appropriate to look at literature in every.
So you're not going to answer the question respectfully. We can move on then. I would thought that would be a simple one. You're familiar with the scientific report of the 2025 Dietary Guidelines Advisory Committee, is that correct?
Yes.
And you're familiar with the members who wrote that, who were on the Dietary Guidelines Advisory Committee, right?
Yes.
Got it. One of the things in this same article, which you wrote as a bit of you said misinformation, which you're attempting to dispel, is that there are no conflicts of interest. Is that correct?
The discussion is that conflicts of interest was considered in the process to establish the Dietary Guidelines Advisory Committee. I think conflicts of interest, whether real or perceived, is an extremely important conversation in nutrition science.
Right.
One of the biggest risks is that when guidelines are perceived as politically motivated, they stop being seen as neutral science. Administrations change every 4 or 8 years, and with each new administration comes a new set of priorities. If one administration emphasizes health equity while another removes it from the agenda, it makes the guidelines appear more like political tools than consistent scientific standards. For ordinary Americans, this inconsistency creates confusion and doubt. People want to know what is truly healthy, not what the political climate of the moment decides is important. If scientific recommendations seem to shift not because of new evidence, but because of changing political priorities, public trust is eroded further. Another serious concern is the perception of corporate influence. When the public learns that advisory committee members have financial connections to companies that benefit from certain dietary outcomes, it raises suspicions that guidelines may be crafted to serve industries rather than individuals. Even if experts insist that decisions are based on science, the appearance of bias is enough to damage credibility.
Right. One of the members of that committee is a man named Chris Gardner. He's a practicing vegan. He's an environmentalist activist, receives funding from a company called Beyond Meat, which is trying to run cattle producers out of business, wants to move towards plant-based diets. Do you think that that's a conflict of interest, that he is on this panel advising the United States in an official capacity about what foods are nutritious and what aren't, whenever he has a obvious financial interest in Beyond Meat?
I'm not, I will say that conflicts of interest were reviewed by
I'm just asking if it is a
Office of
conflict of
Ethics
interest.
within the Department of Health and Human Services who chartered the committee. I think that those things should be disclosed and discussed. And the department, the administration was aware of those affiliations.
So that is a conflict of interest. Is that your testimony?
I'm not an attorney in ethics.
Neither am I, but it's pretty obvious, isn't it?
Well, if you're talking about a financial conflicts of interest, that is something that our ethics attorneys review and assess. So I do not do that review of our members in that process. We do have individuals who support.
So your testimony is that you don't know if this is a conflict of interest or not?
Well, I will say, I mean, there are processes, and I think part of what the
It's just a yes
conversation
or no
is
question.
with MAHA is should those processes be stronger?
Right. It's just a straightforward yes or no question. Is this a conflict of interest or is it not?
It could be
That somebody
perceived
who
as
is
a conflict of
advising
interest,
us
yes.
on what is
also
nutritious
say-
food has a financial interest in a business that is trying to run cattle producers out of work.
I will say that is reviewed by our legal counsel
I yield my time back. That's
looking
fine.
at conflict of interest.